All right, we're here today with Dwight, and Dwight is about to start our treatment with Dr. Davis. Tell me a little bit about the knee pain that you're experiencing.
At the moment, not a lot of pain, but sporadically the left one will pop out of place and I'll have a pinched nerve.
Okay.
And when that happens, then it's pretty difficult to walk. When it pops back in a few days later, then it takes about 3 days to recover.
I see. So what do you think is causing your knee pain?
My lower back. The x-rays showed that the discs were degraded to some direction and not a lot of blood flow was going to my knees, which in turn will make the knees weak.
Exactly. So right now you have a little bit of discomfort, but not too much, right?
Right.
And what would you say your number is?
2.
2.
For
Okay.
the knees.
Any tightness or strain when you did that?
No.
Okay, so sitting to standing doesn't cause you any problems.
Right.
Okay. So I'm going to have you put your feet shoulder length apart.
Okay.
Both arms out in front of you. Keeping your heels on the ground. I'm going to have you squat down as low as you can. Any discomfort or pain doing that?
The lower back.
Okay, and you were feeling that in the low back?
Tightness.
Yeah, more tightness than pain?
Yes.
Okay, all right. So the next thing I'm going to have you do, Dwight, is I'm going to have you just go up and down the stairs with me.
With my arms out?
No, you can put your arms down and just normally walk up and down the stairs. Okay, and back up. Any discomfort or pain that you're experiencing going up and down the stairs?
A little bit in the lower back to the back side of my hips.
Okay, and did you notice it more discomfort going up the stairs or coming down?
Actually, going up was a little bit more.
Up the stairs? Okay, perfect. That just gives us what group of muscles we're going to start working with.
Okay.
All right, thank you. And you ready to get started?
Certainly am.
Let's do it.
And go down and out with your foot. Turn those toes out. Yeah, a little bit of breath. Straighten it out again. Nice deep breath. And pull up. 1, 2, 3, 4. Pull up. 1, 2, 3, 4, 5, 6, 7.
All right, Dwight, I'm going to have you walk down the hallway for me.
All right.
Off his toes. It's good.
You're standing up nice and straight.
It's actually really.
No, run. No, just kidding.
It's actually pushing off his toes.
Come on back.
All right.
Yeah, it's actually good.
What changes have you noticed? Just with the knees and the back.
The knees seem to be allowing my hip to rotate further.
Good.
And I haven't tried it, but I know my neck is because it'll move about an inch farther each direction, I'm sure.
All right, well, we're going to do those when we go out. We're going to go outside and do those exercises again.
How's
Okay.
it feel when you're walking?
I'm sorry.
How's it feel when you're walking?
A little bit better. Yeah.
You notice you're walking better.
I think I am.
Yeah, you are.
My tracking is elongated, so I have more
You're
of an
walking
even.
with better. Yeah, exactly. An even stride. It's a
that's-
really good stride.
And I knew that's one of the things that would hurt my ankle,
Yeah.
being out of line.
And we're back with Dwight. Dwight has finished his treatment with Dr. Davis on those knees. So I'm going to ask you just to stand up for me. All right. Any changes there?
Elongated a lot of muscles. Which,
Okay.
Let's.
You
more
feel like
free
they're all
rotation.
engaging?
Yeah, more rotation.
Okay. All right. We're going to have you put those feet shoulder length apart. Arms out in front. In front.
Front. All right.
Keeping your heels on the ground. How low can you go?
Oh.
Woo! That was pretty fast. Well, you did a good squat
faster
before.
And a little freer.
Okay.
Maybe went even a little bit lower.
All right. Let's do the stairs, Dwight. All right. So what changes have you noticed?
Probably a 20% reduction in pain walking up.
Okay. 'Cause
Maybe
you-
a little bit more.
Okay, because you were only at a 2 when we started because your knee
Right.
was in place.
Yes, but the muscles that surround it, they're looser and have more range of motion. It feels less strenuous to walk.
And how about that low back? Did you notice that it was looser with your back when you were going up and down the stairs?
Just a little bit, yes.
Okay, all right. Perfect. So are you happy with today's visit?
Certainly, yes.
All right, welcome to the family.
All right.